Welcome to another deep dive with Snazzy Surgeon, where we uncover Bailey in love. And as surgeons, I think we can all agree that when we feel a discrete breast lump, it can be,
Oh,
uh,
absolutely.
yeah, a little bit anxiety provoking. So today we're going to really dissect what Bailey in Love 20th edition has to say about the causes of these lumps.
I think that's a great idea.
Yeah, I think it's going to help give us a clearer understanding, of everything from benign, very frequent lesions to the ones that really make us worry about malignancy. What do you think?
Yeah, no, I agree. And Bailey and Love really breaks it down nicely, into those two big categories, benign and malignant.
Right.
And then within the benign group, they even split it further into non-inflammatory and inflammatory causes. So it's a very systematic approach that's super helpful, I think, in our practice.
I totally agree. And I think, it makes sense to start with that benign, non-inflammatory group. So, I think we all see fibroadenomas pretty frequently. That's a really common one for us. And then we have the ductal papillomas, which are, within the ducts themselves.
Right.
But then there's also these phyllodes tumors. And, we really need to be able to differentiate the benign form. So what are your thoughts on that?
Well, yeah, benign phyllodes, they're these fibroepithelial lesions, and usually they're slow growing. But the size can be kind of a tip-off, right, compared to a fibroadenoma.
Yeah,
They can get pretty big.
it can get very large.
Exactly. And then you also have these hamartomas. Now, those are kind of interesting because they're basically just a benign overgrowth of normal breast tissue components.
Like a little bit of everything, just all mixed up together.
Exactly, exactly, all mixed up. And then, of course, for our lactating patients, we got to think about galactosales. Those are those milky cysts, right, that come from blocked ducts. And then, of course, the simple breast cyst, which I feel like, we all see those. Those are often palpable, sometimes tender.
Right.
And then you can have trauma to the breast, which can lead to hematomas, just a collection of blood. But then, the one that can really mimic malignancy is traumatic fat necrosis.
Yeah, that one is really tricky, and it can look really scary on imaging too. So are there any clues that you can give us that kind of make you lean towards it being benign when you see that?
Well, I think the history is really important, right? So if there's a clear history of trauma, and then you see how that lesion evolves over time, that can be really helpful.
Mhm.
Because, unlike malignancy, where it often kind of sneaks up on you, traumatic fat necrosis, you might see, bruising, skin changes initially. And even on imaging, you might see patterns that are more typical for fat necrosis,
Yeah.
rather than just like a solid mass with irregular borders.
Yeah. Yeah, that makes a lot of sense. So now, Bailey and Love also talks about these benign inflammatory causes. And they really split it up into infectious and non-infectious.
Right.
So what falls under that infectious category?
Well, you have, your breast abscesses,
Hmm.
and those can be, acute, like a bacterial infection, or they can even be tuberculous.
Oh, wow.
Yeah. And you can also have those sterile antibiomas. So that's after, someone's been treated with antibiotics,
Mm.
and it kind of forms this sterile collection.
Interesting. Okay.
Yeah. And then, you have granulomatous mastitis, which is, it's an inflammatory condition, can have a lot of different triggers.
Hmm.
And then there are some rarer infectious causes too, like parasitic infections, things like hydatid disease or filariasis, and then even fungal infections like aspergillosis or blastomycosis. But those are less common in, typical practice.
Right. Right. That's a whole lot of stuff to think about. And then on the non-infectious side, they talk about periductal mastitis.
Mhm.
Is there anything in particular that stands out to you about the presentation of periductal mastitis?
The thing that's really interesting about periductal mastitis is that it can present with, um, it can present as an evanescent mass.
What does that mean?
So basically, it's a lump that appears and then disappears, like within days or even weeks.
Oh, wow.
Yeah, and that can be a real clue because, it comes and goes, and the pain and tenderness that kind of comes and goes too. So that's kind of a hallmark.
So if you see that, a fleeting lump, especially in the setting of inflammation, you should really think about that.
Exactly. Exactly.
Okay, so now I think it's time to talk about the big one, the malignant causes. So what does Bailey and Love say about those?
Well, the one we're all thinking about, of course, is carcinoma of the breast.
Right.
And, that includes both invasive ductal and lobular carcinomas. And then you have DCIS, ductal carcinoma in situ. But we also can't forget about malignant phyllodes tumors, which were different than the benign ones we talked about before.
Right.
Because they can be really aggressive and they grow really fast.
That's a really important distinction to make. So how can we tell the difference besides just the growth rate between benign and malignant phyllodes?
Well, I mean, ultimately, the histopathology is going to be the definitive answer,
Right.
but clinically, malignant phyllodes tend to be larger. They tend to grow really quickly.
Yeah.
And you can even see skin changes like ulceration, which is a red flag. And even on imaging, they might have more irregular borders and they look different inside, more heterogeneous.
Right, right. So really, it's about putting all the pieces together, the clinical exam, the imaging to get the full picture.
Yeah.
And then I know Bailey and Lvov also mentions some special considerations, and one of those is those evanescent lumps again.
Yeah, those evanescent lumps, they often go hand in hand with periductal mastitis
Okay.
because, remember how we said the inflammation can kind of come and go?
Right.
Well, that can cause a palpable mass to appear and disappear as well. And it's important to remember the pain and tenderness,
Yeah.
that resolves at the same time. So that's really characteristic.
Okay. So then what about the opposite? So what if a lump disappears, but the pain and tenderness, it either sticks around or it even gets worse?
Ah, okay. So in that case, you got to think about things like ruptured cysts or galactoscles.
Okay.
Because what happens is when those fluid-filled structures rupture, they leak, right?
Right.
So either the cyst fluid or the milk, it leaks into the breast tissue around it, the stroma,
Yeah.
and that causes inflammation. So you get pain and tenderness, but the actual lump itself might not be palpable anymore.
So even though the lump's gone, there's still something going on.
Exactly. And it's really about understanding that whole sequence of events clinically.
Right, right. That makes a lot of sense.
Yeah, and I think, this deep dive into Bailey and Love has really highlighted just how many different things can cause a breast lump.
Oh, yeah.
We have to think about the whole spectrum from, those common benign things all the way to, the possibility of malignancy. And we have to understand how inflammation can play a role. And then there are those special presentations like the evanescent lumps and the ruptured cysts that can really throw us off.
Yeah, absolutely. I think this is super helpful for all of us, and it's really going to make us better at diagnosing and managing these patients. So thank you so much for sharing all of your insights today.
Oh, it was my pleasure.
And thank you for listening to our deep dive. We will see you next time.